Almost 500,000 Australians are affected by an eye condition called Fuchs Dystrophy. It can lead to blindness if left untreated. In the past, a corneal transplant was the only solution, but now a Sydney specialist has developed an alternative. As Tracy Bowden reports, it could be a game changer around the world.
Down to Ovalon?
Yep.
Nikolai Zaitsev and his wife Saskia are enthusiastic bike riders, but last year Nikolai's failing eyesight put that activity on hold.
You have vision, but it's not clear. You can see the tree, but you can't see the leaves. Because the problem develops over time, you're adapting and adapting, but if you look at over at any distance, yes, you've lost a lot of clarity.
Nikolai has a relatively common eye disease called Fuchs Dystrophy that affects 1 in every 25 Australians over 40. His world is becoming more and more blurry.
In the future, I wouldn't be driving anymore, either voluntarily or by law. The optometrist would say, no, you can't drive anymore.
What Fuchs dystrophy does is slowly cause protein to aggregate on the inner surface of the cornea. And if enough of that protein develops, more serious problems begin to occur with swelling in the cornea, and in the end, sometimes loss of vision in the eye. How are you, Nick? You feeling okay?
Yes.
Good man. This won't take long at all. Thanks.
In the past, the only option would have been a complex procedure involving a corneal graft, requiring lifelong anti-rejection medication and the use of precious donated eye tissue. Today, Nikolai is undergoing a groundbreaking technique developed by Sydney ophthalmologist Greg Moloney.
Not every case of Fuchs dystrophy will require a transplant tissue once that unhealthy protein has been removed. So the goal of today is to remove that protein, and then we'll stimulate his own cells to heal without the need for a graft.
The procedure takes only 6 or 7 minutes.
The cornea, where you can see the bad stuff we've stripped away, and the centre no longer has that, blocking the vision for Nick. Down the microscope, it looks like we made a window. That's good. Well done, Nick.
So how important is it to find an alternative to having to do a transplant every time?
I think if we can find any way to reduce or to find non-transplant options for patients with Fuchs dystrophy, the potential effect on our specialty could be enormous. With patients being taken off or out of the transplant waiting list, and that tissue going to somebody else who perhaps needs it more.
At the moment, there's probably 10 million people around the world who are waiting for a corneal transplant, and only 1 in 70 are going to get it.
Ophthalmologist Gerard Sutton heads the New South Wales Eye Bank, which collects, stores and distributes donated corneas. He says the procedure could be a game changer in developing countries with limited supplies of eye tissue.
Over 50% of the world's population don't have access to corneal transplantation. And so if we can have a technique or a surgical technique where we can treat the condition without the need for the cornea, then that's a real contribution. So it's definitely pioneering work. We recognise that, and the work that Greg's doing is recognised internationally.
Hello, my name is Eric. I'm one of the nurses that will look after you this afternoon. For the next 10-15 minutes, we're gonna take off your dressing. We're gonna give it a clean, and then we're gonna put in the eye drops that the doctor has prescribed for you. And then we're gonna do an eye test, put in a lot of eye drops, and then we're gonna go see the doctor. Is that okay for you? Yes. So whenever we are taking off pads, doing cleaning, making sure that you are cleaning your hands before. You can get yourself these hand sanitizing gels from the shop or chemist, or you can use water and soap to give it a clean before touching the eye. Okay. So come bring other side. Good. So this is an eye shield. You'll need to attach that over your left eye for the next 7 nights. So the pointy bit of this shield goes to the corner of your eyebrow and your nose.
Mm-hmm.
And you tape it with, you can use sticky tape or dressing tapes that you can get from chemist or supermarket. Just make sure these holes are kept open so your eyes is able to ventilate.
Okay.
The purpose of this is to prevent you from scratching the eye, and also the dust and mites of the pillow to have direct contact with your eye, so that will delay your recovery. After each night, just wash it with dishwashing liquid over the sink and just air dry with it.
Okay.
Okay. So at home, you'll also need to clean your eye at least twice a day, once in the morning and once in the evening, or whenever you came back from outside, because you want to remove all the foreign objects that's around the eye area, because they will delay your recovery.
Okay.
So you use cooled warm water to clean the eye. First you boil the water, you put it in a clean container, cool it off to room temperature, and get yourself either these makeup removal pads, or either you can use tissue, fold it, and then you dip it in the water, and you clean only from nose to outside. Try to avoid back and forth and rubbing it with this. Just be nice and gentle.
Very well.
The other alternative is using normal saline solution.
And what size bottle should I use?
If you use a big bottle, they only have a 24-hour life. So after 24 hours, it'll be no good. It'll be contaminated. And after you open that, it needs to be stored in the fridge. And the better way of this is using these single-use ampules. So you twist the top open, and then you put it on the cotton swabs, or put it on a tissue paper, and again fold it, and then we clean from nose to outside, eyes closed. When you're cleaning the bottom eyelid, make sure you're looking up, and when you're cleaning the upper eyelid, make sure you're looking down. And then we again clean only from nose to outside. So like I said, we fold it in half, and try not to touch the area that is gonna contact your eye. Then I'll ask you to close your eyes for me. So again, we clean from nose to outside, and then we discard it. And then we repeat the steps until your eye is clean. After the procedure, just wash your hands and make sure that the gunk and other foreign stuff doesn't stay on the hand. Okay. And then now we're gonna put in the eye drops.
I've got some here.
Okay.
They're in a chiller pack, like I was told.
All right. Okay. First of all, you need to wash your hands. We don't want the germs to travel from your fingers to the bottle and into your eyes, because that's gonna further delay your recovery. And just make sure when we remove the lid, we're gonna place it on a clean surface, such as a piece of tissue paper. So try to avoid to be having direct contact with surfaces.
Okay.
With clean hands, we are pulling the lower eyelid. We create a little pocket, aim for the pocket. And just look up the ceiling for me. Okay. And once it's done, just close the lid. And then store it in a cool, dry place. And then wash our hands again after.
Okay.
So now we're going to put in the second eye drop, and they need to have a 3 to 5 minute gap in between, because we don't want to make a mayonnaise in your eye. Okay. All right. Okay, again, same rules apply. First rule is
Wash the hands.
That's right. And then our lids are placed onto,
A clean surface, like a tissue, like a new
Perfect.
tissue.
yes. And then, so again, I'd like you to look up the ceiling for me. So this is cool. Perfect. Just close your eyes and keep it closed for a minute. So that will keep the eye drop inside the orbital area. That's very important. If you have any new redness, new pain, new sensitivity to light, or sudden decrease in vision, please make sure you call your ophthalmologist rooms, or you present yourself to the eye hospital emergency department.
Very well.
Okay.
Thank you for being today with us. I want to ask you a few questions about the process for the procedure.
It had deteriorated to the point that I couldn't see at all. It could see shadows and things like that, but I wasn't seeing any real vision. It was shadowing, it was not precise, it was very upsetting.
With this procedure, one of the things people usually ask us is that the time of recovery might take longer than when you have a graft. You have done both procedures.
Yes.
Descemetorhexis without a graft on your left eye and with a graft on your right eye.
Correct.
How was your perception of the recovery time?
The graft was faster in the sense that within 14 days I was all right and could see better. But I had to be careful. You can't do things. You have to play sport, and they told me not to do sport until it was all over. 4 weeks later, this left eye, which has now been operated, I was expecting a recovery of around about 3 to 4 weeks. It was improving from day one, all the time. Virtually, after 3 weeks, I was starting to see very well. 4 weeks, really, really good. And from now on, the last 2 months, I really, have really good vision developing. So I'm very, very happy with the results.
Okay, so yeah, and basically that will be my last question. How do you feel your vision is right now?
Very good, very good. I could joke that I'm having the vision of a young man again, and I'm sorry, I'm an old man now. That's really very important for me.
So now that you've gone under both procedures, if you had this option again to choose, what would you prefer?
I would prefer what happened to me now, the actual operation we had, simply because it makes a lot of sense not to have a graft, because there's always, I understand there is still a rejection possibility. Not necessarily it can happen with eyes, but there is always a possibility, and I still have to put drops in here every day, whereas this one is perfect, nothing happens anymore, I don't put drops in anymore, it's like a proper eye I always had. So I'm very happy about that result, and I would always prefer the operation that Moloney did.
It's now about 2 months since the procedure, and Nikolai's vision continues to improve. How are you going?
It's very good. It's so good, I'm looking at doing the next, already starting the schedule to do surgery on the next eye. Yeah, life is, just that much clearer as you go.